Welcome to week 3 of our month-long series on vector-borne infections. We've talked about symptoms, we've talked about testing, and today we're going to dive into the details of treatment options. Made to be Whole is intended for informational purposes only. It's not intended to replace the advice or care of a licensed healthcare professional. Participating in this podcast does not constitute a provider-patient relationship with Krista Michener, AHP Integrative Health, or any of the guests featured on Made to Be Whole. Krista Michener, AHP Integrative Health, and any featured guests aren't responsible for any losses, damages, or liabilities that may arise from use of information obtained in this podcast or associated materials. Please consult a healthcare professional for any health-related concerns that you are experiencing. So now you know what Borrelia, Bartonella, and Babesia are, and maybe you've been tested or had a family member tested and it's positive, and then there's the big what next, how to treat. There are a lot of different opinions, some based on experience and science, some not, out there, and it is really difficult to be a consumer. It's difficult enough for me as a provider to sift through research, to sift through treatment options, but also because, as we've talked about, each individual is so different. You cannot have a one-size-fits-all protocol. You just can't. It's not good science because there's a major factor there that alters the course of things. I have some people who will say, do you use antibiotics or herbs? And my answer is yes and maybe. It just depends, again, on the individual and a couple of factors. First of all, what infection or infections do you have? So that drives it. What do we know about how those bacteria behave and how we can best bust up their lifestyle and get them to go take up house somewhere else? What do we know about your immune system? What do we know about your budget and your preferences? Obviously, all of those things come in. But I've told many patients, my goal is not to use or not use antibiotics. My goal is for you to be well. My goal is for you to have good quality of life and to stay well and avoid long-term complications from these infections. And so we look at your symptoms, we look at your test results, we look at your response to treatment, and we put together a smart plan that's targeted at your long-term health. I think I've told the story on this podcast before, but I'll tell it again. My son Daniel, who tested positive for Lyme, Bartonella, and Babesia, we first started treating the Lyme, and he had psychiatric issues and dysregulation issues since he was very young. And one thing he had told me as an adult that I didn't know is from the time he was about 4, he would have involuntary impulses to hurt people, that he would have to basically pull back his own arm to keep himself from hitting me or pushing me down the stairs. And it wasn't because he didn't love me or he thought that was a bad idea, but he had so much internal rage and all of these involuntary issues, and he was on the verge of exploding all the time, and he hated that about himself. He didn't like feeling that way. Of course, we had been to therapists and tried medication and lots of different things. We started treating for Lyme disease, and his rage dramatically improved. Dramatically. He started to feel more in control and safer. And after about 4 months, I said, you know what, this is long enough. He doesn't need to be on these longer term. We're just going to wrap up. So we stopped the antibiotics and the rage came back. So I could say, oh my gosh, this is so awful. I don't want my little boy to be on these antibiotics longer than a specific amount of time. Or I could say, thank God we found out what's going on and there's hope for getting this kid well. So it's going to take longer than I like, and I've got a lot to learn, but there's hope. This is amazing. And in the realm of antibiotics have got a bit of a bad rap. Yes, there's such a thing as antibiotic overuse, antibiotic misuse. Yes, antibiotics can cause problems, but you've got to look at what's called risk-benefit ratio, okay? What are the risks of using them? What are the risks of not treating? And how does that play out for you? The things that people get in trouble with long-term antibiotic use, first of all, you want to make sure you're using the right medication for that specific bacteria and how that bacteria behaves. You have to use the right dose and you have to use it for an appropriate amount of time. It is not unheard of in medicine to have longer courses of antibiotic therapy for things like tuberculosis, for things like leprosy, for even an infection called Brucella. So the fact that we have to do this a little longer for some patients than we would like doesn't mean that we're misusing it. It means we know the enemy and we are making an educated decision about how to take care of the enemy. One thing I have noted is the people who have come to me before who said they were on antibiotics for really extended periods of time with other people and their gut's never been the same or they've had this problem or that problem, the person treating them wasn't being preventative and looking at what antibiotics can do. I mean, the number one thing is protecting your gut. Well, you need to be using a really high quality probiotic the entire time you're on it. I mean, that's a no-brainer. If you're gonna be on antibiotics, you need to be taking at least 100 billion CFUs. CFUs are colony forming units, so instead of being dosed in milligrams, they're dosed in CFUs. So you will, with the world of probiotics, I promise you will get what you paid for because, like with everything else in my life, I've tried to do it cheap and it's no bueno. The minute I switched to the not cheap probiotic, I had instant improvement in my problems, and actually post antibiotic treatment, my gut's better than it had been for years because I had severe abdominal pain, reflux, diarrhea, bloating. I've had my scopes, I've had my colonoscopy and endoscopy, and like this just was not helpful feedback. I'd cut out gluten, that did make a difference, but I was still just randomly very uncomfortable. And post antibiotic therapy, I just don't have those problems anymore. But that makes sense. If you have an infection that's in your gut, you have to treat it. And an interesting phenomenon with antibiotic therapy or with herbal therapy, anything that's effectively targeting the microbe, which is a general word for bacteria, parasite, virus, like the bug causing the infection, you will have die off first where there's good blood flow. And one of the places with the best blood flow is your GI system. So it's very possible that you'll start any sort of treatment, whether it's an herb, an antibiotic, something else, and you're like, oh, my stomach. But give it a little time because a lot of times that's because we're actually effectively treating what's there. And if you're willing to wait it out, we treat the symptoms, we push the probiotics, actually, you're going to feel much better in the end. So we've got to be educated, we've got to be smart, but you have to use what works. You have to use what works. And it depends on what your goal is. If your goal is just to feel better, you may be able to get by with strictly herbal regimens. But if you have neuropsychiatric symptoms, it's really difficult to get through the blood-brain barrier without using appropriate antibiotics. If you have Babesia, I've found it very difficult to clear without using prescription medications. Now, those aren't primarily antibiotics because Babesia is a parasite, it's not a bacteria. But all of these creatures, so to speak, they have their own little ecosystem they've set up in your body. So I'm gonna use the example of Babesia because I think it is really easier for me to, like, break down why we use so many different things and why it takes time. So Babesia, parasite, spread by a tick, lives in your red blood cells. When your red blood cells are healthy, they take oxygen to your whole body. They take it to your brain, to your legs, to your lungs. So if you do not have consistent good oxygen flow to all those places, you just feel like garbage. You're tired, you're heavy, all this stuff. Well, not only is it in the red blood cell, it also makes these fibrin nests in your capillaries where its eggs are hidden because it's a living, growing, reproducing thing. So I have to do multiple different things in order to effectively get rid of that and keep it from being an ongoing problem. I have to, first of all, get rid of the stuff that's kind of loose hanging out there. Okay. So for most people, will start with a medication called atovaquone, or Mepron is the name brand. It's a prescription. It's a thick yellow liquid. My kids call it yellow paint. It doesn't taste good, but I don't think it tastes as bad as it looks, because the first time I saw it, I thought, "Oh my gosh, this is not happening." But my expectations were so very, very low that it really wasn't that bad. So I start a lot of times with atovaquone, because I describe it like the vacuum cleaner. It's going around, it's getting everything that's kind of loose, okay? The stuff, as red blood cells die, as these nests come to fruition, the eggs hatch, it's cleaning things up. Then we'll typically add something that goes into the red blood cell. So there's actually really good evidence about the combination of atovaquone and a medication called tafenoquine, name brand Arakota, but that combination of things is very effective against Babesia. But then if you look at the whole life cycle of that, I've still got to deal with those nests. So typically use fibrinolytics, meaning things that break up the fibrin, such as lumbrokinase, so that we can gradually dissolve these. But then we've still got to have other stuff on board, so that as we break up the nests, we're clearing those babies so that they don't go on to have their families. There are, Artemisia can be a great part of that. It's a wonderful, wonderful herb. There are a lot of different, like, adjunctive things that help. But when I hear people say, "Well, I'm just going to take wormwood, which is artemisia, because it's really, really good against Babesia." It's true. Wormwood does have great benefits for multiple different things, and it's good against Babesia, but is it alone able to get in those red blood cells? Is it able to break up those nests and then take care of what's inside those, so that we're stopping the cycle? So when we talk about different treatments, we're talking about not just what works in a petri dish, but what works in that, like, ecosystem of your body. I'll go to Bartonella next. There are herbs that I really like to include for everyone who's able to tolerate them. One is Allicin, not the girl's name spelling, it's Allicin. It's the medicinally potent part of garlic extract. It has good effects against Bartonella biofilms. I typically start people with a low dose and work them up to a pretty hefty dose. I've had some people have significant improvement of symptoms just by adding allicin. But with Bartonella, we know we've got to be able to get where the infection is. So part of this depends on your symptoms. Part of this depends on the different reproductive cycles of the bacteria, be able to hit it in the different cycles. So other tools that are very specifically good for Bartonella: oil of oregano capsules. Oregano also has good effects. And I'll tell you a personal story about oil of oregano with Bartonella. Bartonella causes a lot of anxiety for a lot of people, and when I added oil of oregano, I was like, "It's oil of oregano, I just went straight to the full dose, who cares?" I had a severe, severe psychiatric herx. I was freaking paranoid for, like, 2 weeks. I realized what was happening, and I was already miserable enough. I'm like, "I'm just gonna push through it. I'm not gonna start this over again at any point." But I was, like, crying. I was convinced my marriage was on the rocks. My husband's going, "What is going on? Like, we're fine. We were fine last week. We're still fine. We've been fine for 20 some years." But, like, it was brain on fire. But I will tell you, after I got through that, my mental health was much better. Like, each step that I personally took in treating Bartonella and Babesia improved with the Babesia improved the depression. The Bartonella specific treatments really helped anxiety tremendously too. So natural remedies, those definitely are good ones for Bartonella. Sometimes we will add other things like the lumbrokinase. That's because Bartonella also makes fibrin deposits. Bartonella makes a lot of biofilms that adhere to the inside of those blood vessels. I mentioned, though, when you have neuropsychiatric symptoms, You really have to use things that can get across the blood-brain barrier for effective treatment, and they obviously, for me, oil of oregano was a piece of that, but one category of antibiotics that can be very helpful that definitely, I mean, you have to be monitored properly when you're taking this, but rifampin or rifabutin, they're really good at getting across the blood-brain barrier, and they can be a really helpful part of treatment. They're kind of rough because you will feel tired, it's intense treatment, but they're effective. They have to be used for a longer period of time though, typically like at least 4 to 6 months, and then we'll stop, because we can't just set a bomb on people, right? We've gotta go at this slowly and know this is a growing, reproducing thing. Another strategy, and there are other traditional antibiotics I'll throw out there that have good effects against Bartonella. Bactrim has good effects against Bartonella, azithromycin, clarithromycin, they have good effects against Bartonella. There are other fluoroquinolones as a category of medications that includes Levaquin, but that's something I really, really shy away from my patients in general unless I have a culture or something telling me I have to use it, because those can increase your risk for tendon rupture, even not like in that instance, but down the road. But there are, occasional instances where including that can move the needle for someone. Another really fascinating therapy that has great effects against Bartonella from an infection perspective, but also a symptom perspective, is something called methylene blue. So, methylene blue is a dye. It's been used medicinally since the late 1800s. It has to be compounded. So, we have compounding pharmacies that will make capsules for it. But methylene blue does a couple of really awesome things in the context of chronic infection. It has fantastic effects against Bartonella, and it's got good stuff against Borrelia, which is that Lyme family of infections too. It's very, very good at crossing the blood-brain barrier. It has these antimicrobial, antibacterial effects without carrying the risks that I think the traditional antibiotic does, so it's not going to disrupt your gut. It has amazing benefits for some people for anxiety and depression, even as a standalone therapy outside of this world of infection. Sometimes low dose methylene blue can really move the needle for some people. It increases oxygen supply to your brain. It can offset some side effects of some other medications. A few caveats with methylene blue. First of all, you need to have some labs checked before you take it. There's something called a G6 PD level. I always feel like a lot of these tests sound like Star Wars bots, G6 PD, but you have to get your G6 PD level checked, because if you have a G6 PD deficiency, then methylene blue can cause something called hemolytic anemia. It's very rare. I've only had one patient who's had it so far, actually, but it's definitely something you want to check out because you don't want to find out the hard way that can cause you problems. You have to find someone willing to prescribe it. I made reference to this in our episode on supplements, but with methylene blue, you can purchase it like from Amazon, but I would strongly recommend against that because, first of all, it's not always pharmaceutical grade. Okay. So that's a big deal. We don't always know about quality control. You don't want to be using a methylene blue liquid. A lot of times people I find are buying liquids off Amazon that can stain your teeth and your tongue. I know that it's tempting if you think you can save a few dollars in DIY, but there's some things you really don't wanna mess with. We know we've found instances of if there's not good quality control, it's not pharmaceutical grade, there's been heavy metal contamination, so it can do more harm than good. Because it has to be compounded, it's not covered by insurance. You have multiple different options for compounding pharmacies. The 2 that I use the most, or I guess the 3 that I use the most, there is one here in our area called the Medicine Center, who's recently started carrying it. I use InfuServe America a lot. They are actually a Lyme specialty pharmacy out of Florida. They're national. They'll mail to anywhere. There's also a pharmacy in New Jersey called Care First Specialty Pharmacy. Probably has the best prices. The nice thing too, if you go on their website, for anything you get from them, you can put in like the dose and the quantity, and they'll shoot back the price so you know ahead of time. They're a little, mm, from my experience, my patient experience, their customer service isn't bad, but they're not quite as easy to deal with as like InfuServe America, where people just pick up and talk to you and it's not automated. Medicine Center has the benefit. I do have some patients who don't have the internet and or don't have credit cards, and so they can send a check and they'll mail to you. Methylene blue is just an opening your eyes to some of the alternative things that are out there. I really wanted, when I first dove into this world, I really wanted it to be like, no, people are making this more complicated than it has to be. You have Lyme disease, you just give them an antibiotic and then it's gone. And it unfortunately is more complex than that when you don't catch something early stage. If you get a tick bite and you see it, and then you get that beautiful bullseye rash, you may not think it's beautiful, but it's going to help you get the most proper care the most quickly. And then you actually find someone who's willing to give you an appropriate course of antibiotics. That's actually fantastic because then you've minimized the risk of long-term infection. But we know that tick could carry other stuff too. So, you could get doxycycline prescribed if you're lucky for 4 to 6 weeks, but you can't rule out the fact that other infections could be there. So that's why if somebody comes to me with a tick bite, I like to do prophylaxis, which is prevention for multiple infections, because I know that multiple things can come from that bite. So why is it that Lyme disease, for someone who's had it for a while, doesn't respond to just doxycycline? Because that's the early treatment for most people. Doxycycline, an antibiotic, it's effective against Lyme, it's effective against Anaplasma, Ehrlichia, and Rickettsia, so it's a good early treatment for someone to cast the net wide. But what we find with people still becoming sick is, first of all, a lot of people don't know that they have an infection until it's been years. And then you have persister forms of the bacteria, you have cystic forms. This is kind of what we were talking about with the biofilms, but like these cysts that form around it that doxycycline doesn't penetrate. So doxy will be taking care of the stuff like that's just kind of hanging out, but it can't always get into the tissues or break through those cysts. So you've got something that has evolved to protect itself, and you have to just have more weapons in your arsenal, and you have to be managing inflammation, you have to be looking at the immune system, nutrition, all these other things. So what is long enough? There is unfortunately controversy about this. I don't think that there needs to be, but if you have what's called an EM rash, an erythema migrans rash, which is that bullseye rash, or really any rash that, came from a tick bite, that's diagnostic of Lyme disease, even without like the antibody test coming back positive. And that should be treated with 6 weeks of doxycycline off the bat. And the reason is the Lyme spirochete, that bacteria, it reproduces like every 28 days about. And so you've got to straddle more than one life cycle of the bacteria. It's just a math problem. It's not inappropriate antibiotic use. It's if I use an amount of antibiotics for an appropriate course of time at the beginning, then this person will have to have far fewer treatments in their future. So when you say, some people just get so emotional about, oh, I don't want to take something for this long. I only want to take it for this long. I get it, but sometimes it is math, and right now I'm talking about, okay, you've been infected with something that reproduces every 28 days. I sure want to treat more than 28 days. Okay. What other options do you have if it is not like a right away thing? Like you find out that you have Lyme, but that you think you got it last year because you were camping and you had a rash and you got kind of the flu after that, but then you've been getting more and more tired and more sore. It's doxycycline is still an okay place to start, but you have to add things that address that cystic form of it, which would include a prescription like metronidazole or a supplement called grapefruit seed extract. You it's really too complex to kind of lay out everything that could be used. But things that everybody could do for immune support in the context of these infections would include the allicin that I brought up for the Bartonella cyst, allicin being that garlic extract. It's got great antibacterial, antiviral properties and some antiparasitic properties. We've been taking it at pretty high doses for over 2 years when we figured out this is what my family's been dealing with. And my husband pointed out, he said, "Have you noticed as sick as we are, we don't get sick anymore?" And I really do attribute it to the allicin. Since I started taking it, I have not had a cold. I had one time when I felt like bronchitis was coming on because I used to get it every year. It didn't progress to anything worse. I was exposed to COVID. I had had it before. I didn't catch it again. Not promising that I'll have that outcome for anyone, but some of these antimicrobial herbs can be really, really good for prevention, for boosting your immune system in general. The other thing too, if somebody's treated appropriately and doesn't get better, think other infections. There can be viruses, there can be Bartonella, Babesia, Ehrlichia, Anaplasma. There can be things like Q fever, Brucella. I know this is all kind of mumbo jumbo, but point being, there are other things that can cause similar symptoms. Don't get stuck in that looking at the world through lime-colored glasses trap. Make sure that you keep looking. It may be there, but it's probably not all that is there. And I say this with no disrespect to anyone who just has Lyme disease, because I know it's a challenge, but truly, if you just have Lyme without other infections, without viruses, without all this other stuff, it's a little more straightforward to treat. It's not as horrific as some people make it sound in some cases, with appropriate treatment. When it gets really complex is when you've got all this stuff layered on. So Ed Breitschwart, he's like the Bartonella god of the veterinary world, and, he said, and I am paraphrasing, but you can't drown like a cat, a rabbit, a horse, a dog, a human, in enough doxycycline to kill Bartonella. So that's why this testing we talked about last week is super important, because what works great for one infection may just not work well against another, and I know it's challenging sometimes to wrap your head around. It's challenging for me, and I study this and do it professionally, but just because something's an antibiotic doesn't mean that it's the right antibiotic for that bacteria. It's like saying, well, cinnamon is a spice. Why isn't it good on my French fries? Well, unless they're sweet potato fries, it just doesn't fit, right? And so you may have an antibiotic that's a great antibiotic. Because a lot of people say too, oh, give me something strong. Well, it's not about what's strong, it's about what's appropriate. It's about what's appropriate. Antibiotics, some of them work by actually killing bacteria. They're called bactericidal. Some are bacteriostatic, meaning that they just stop the growth of it, so it stops reproducing. Some of them have longer half-lives, some of them have shorter half-lives. Like, it's so much more complex. So my main advice to you, I know that there are people who would love for me to say, "Oh, this is the Lyme protocol. If you have Lyme disease, take these things and I promise you'll get better." I would be doing you a real disservice and kind of committing malpractice if I did that, because it depends on your body, your immune system, like the level of inflammation, your symptoms, but also what infections are involved, how you respond. You really need the help of someone more skilled and experienced in attacking these and understanding how they work and how they work in the body. How to find that, I will be recording our next episode from the 2024 ILADS conference, the International Lyme and Associated Diseases Society. It's going to be in Texas this year. They do have a provider directory that you can go and search, put in like your zip code and find someone that is ILADS trained. I've found them to be very helpful. There's unfortunately a bit of a schism in the world where you have people in some medical groups, which are just trade groups, if you think about it, like a group of like-minded people who get together. In one example, it's the Infectious Diseases Society of America, who's very against chronic Lyme who's like blacklisted ILADs, says that some of these tests are garbage when there's really science to support it. And the thing that matters most to me, if I have someone who's sick and I can identify an infection and it lines up with their symptoms and we can do targeted treatment and they get their life back, isn't that the science that matters? To me, that's all that matters. That's all that matters for my family, for my kids, for me, for my husband. There's always hope. One thing that will disappoint you in your quest for healing is if you feel like you need the affirmation of everyone around you. Just give it up. Just give it up. You're not gonna find it, and you're gonna be sorely disappointed, and for some of you, it's gonna be difficult because people who are close to you and should care about you and believe you don't in the way that they should, and I know that's a very lonely path. I'm fortunate because even though my family, we've all been suffering with this, we all suffered together, so we get each other, and I'm fortunate because I talk to my patients every day, and I know I'm not the only one going through this, but don't set yourself up for more distress than you need to. Looking for affirmation places isn't gonna come from. Align yourself with people who care, who believe you. Align yourself with good science. Don't be afraid to look past guidelines into actual research and data, and don't forget to have hope because you are made to be whole. Have a podcast question or suggestion? Text or call us on the podcast info line at 330-439-0686. Thank you for spending time with me today. If you like what you hear, please subscribe to be notified when new episodes release. And remember, you were made to be whole.